Good morning, everyone. I've had a few questions lately about the assignment I've given you in your 2040 course. It seems that there's a few people that are confused about how the dental chart is used and what the terms mean on the nomenclature sheet. So I wanted to spend 5 minutes today making this video so that hopefully that helps answer the questions you have. We're going to start first by looking at the nomenclature chart, going through that, and hopefully understanding each of the terms. Then we're going to look at the dental chart and go through that a little bit and spend some time understanding what types of codes go where on a dental chart. The reason I've given you the assignment in the first place is so that you can practice with these charts, practice with the codes. So when you come to class and we ask you to start charting on a live animal, you're familiar with how the chart is to be filled out. So that's the reason for the assignment, that's the reason for the video today, so let's get started. Okay, so this is the sheet I gave you that has a whole bunch of the commonly used dental nomenclature on it. On the top left, you can see your calculus indexes. These are the indexes you record when you're charting how much of the crown is covered in calculus. So, for example, the first one, if no calculus is seen on a tooth, on the crown, we're going to put 0 for a calculus index. If more than 50% of the crown is covered in calculus, we're going to give the code of 3 for that individual tooth. The next ones we have listed here are furcation indexes. So furcations are when your dental probe can pass from one side of the tooth underneath the crown and out of the other side of the tooth. So for example, if you have a tooth that looks like this is your crown, this is your root. If you take a dental probe, you can pass it between the roots from one side of the tooth to another. If you can pass it through and through, so from one side to the other, you have a furcation index of 3. If you can only pass your probe less than halfway underneath that crown, you have a furcation index of 1. Next here on our chart is mobility index. That refers to how loose a tooth is. Again, if it can move 1 millimeter in the axial direction, it's an M3. What that refers to is, again, here's a tooth, crown, root. If it can move 1 millimeter that direction, it's an M3. If it can move less than 0.2 of a millimeter, again, same direction, it has a mobility index of 0. Next we come to our periodontal indexes. These indexes are used by the veterinarian after radiographs have been taken. What we're looking for there is the amount of attachment loss for a tooth. So here, again, crown, root, and all our periodontal structures that hold the tooth into the surrounding bone. If we have loss of less than 25% of the periodontum, so everything is still attached through these areas, we have a periodontal index of 2. If we have more than 50% attachment loss, what that would look like is all of these structures have been broken down. So only the periodontal structures in this area of the root and this area of the root remaining. We've got a periodontal index of 4. Next we're going to talk about fractures. We have enamel fractures. So if I go back to this tooth up here, that would be a fracture that is just within the enamel. Let me draw in some dentin and pulp to help. So again, on this tooth, if we have, no, this isn't working. Let me try a new tooth for you. Here's another tooth. Okay, there's your tooth. Here's your pulp in the middle. Okay, so this is all pulp here. And then we've got our thin layer of enamel on the top of our tooth. An enamel fracture would be when just this layer of the enamel is fractured. Moving down the chart, if we have an uncomplicated crown fracture, that means our fracture extends into the enamel and dentin. If we have a complicated crown fracture, our fracture goes through the enamel, the dentin, and the pulp. Going down the chart once more, a complicated crown root fracture. Now we're going to have a fracture that involves enamel, dentin, and pulp, and part of the root. So perhaps it involves an area like this that has been compromised and is fractured and is gone. Okay? How these are recorded. So we say T is for the tooth is fractured, so FX, and then we say which of these it has. It has a complicated crown fracture, or it has a complicated crown root fracture. And this is what is actually charted. Malocclusions. If we have a malocclusion 1, that refers to a malocclusion of just an individual tooth. An example can be lance canines, base narrow canines. Any of those are malocclusion 1s. I'll show you how to chart those in a minute. Malocclusion 2s and 3s are when we have a misalignment of the mandible to the maxilla. More information about those can be found in your book. Let's move over here to our gingival index. Gingival index is obtained when we are probing the gums. So if we go down to this tooth, if the gingiva looks completely normal, we probe it, no abnormalities are found, we have normal gingiva, and we give that tooth a gingival index of 0. If the gingiva on that tooth looks a little bit red and inflamed, we probe it and no bleeding occurs, we say it has mild inflammation and gets a gingival index of 1. If the tooth looks red, if the gingiva around an individual tooth looks red and inflamed, we probe the gingiva on that tooth, and when we probe it, it begins to bleed. Now there's moderate inflammation, and it gets assigned a gingival index of 2. Lastly, severe inflammation. This is when we, just observing the gingiva, it is spontaneously bleeding. That's severe inflammation, and that tooth gets assigned a gingival index of 3. Lastly, we have just a few other codes down remaining here. Most of these you can find information for in your book. So abrasion and attrition, that should be defined in your PowerPoints. Caries, cavities, rarely seen in cats and dogs, but they can occur. Deciduous teeth. If we have a remaining deciduous tooth, we're going to point to that tooth on the chart and write DT. If we see gingival hyperplasia noted on exam, we will indicate where on the chart that gingival hyperplasia is occurring and code GH. I think that's all I'm going to go through on the chart of here for now. Let's look at the actual chart. Let's look at the actual dental chart and start filling in some of these codes on the chart. Here's the dental chart that you're going to be asked to fill in on every dental you do here at Olds College. There's a little information about the patient and you at the top of the page. And then we get to the 2 main sections that are going to be filled in during the dental. One is a picture of the mouth itself. In this case, we can see this is a dog. And the table where we fill in gingival and calculus indexes. When we do our exam, one of the first things we'll do is chart calculus indexes. So let's use tooth 108 for example. Say we look at tooth 108 and greater than 50% of the crown is covered in calculus. Then what we're going to do is under C for calculus index, we're going to record a 3. Okay? Say now we look at tooth 103 and there's no calculus of any type on that tooth. We're going to record a 0 for calculus index. For the purposes of your assignment, you're only going to fill in the codes which I've given you information from. When it comes to doing a dental exam on a live patient, every single box will have a number in it between 0 and 3. Okay? That's where we're going to start with our calculus indexes. Next, we're going to continue doing an exam on our patient. And we're going to go around the mouth in an orderly fashion and find any abnormalities and chart them down. Let's say, for example, we see some dental attrition on the distal aspect of tooth 204. How we're going to chart that is we're going to say it occurred on the distal aspect of tooth 204 and it was attrition that we saw. Say we got a periodontal pocket on the, let's say the labial aspect of tooth 101. We're going to draw an arrow to the labial aspect, write periodontal pocket, and then how deep it was. Perhaps in this case, it's 5 millimeters. Another example might be gingival hyperplasia. Let's say that's on tooth 306. If it's perhaps on the buccal distal aspect, we're going to draw a line on the buccal distal aspect, write gingival hyperplasia. All right? I think that's all the ones I'm going to code on here for now. I hope you get the idea that what we're going to do is draw an line to whichever part of the tooth that it's on, mesial, buccal, buccal distal, distal, etc. So we're going to draw that line to that part of the tooth and code whatever abnormality we found. All right? I hope this adds a little bit of clarification. If it doesn't and you're still confused, please email me and hopefully I can make things even more clear. Good luck. See you soon. Bye.